Everyone. Welcome to this new edition of Mind Debates. This is Aadit Kapadia. I must clarify, whatever we are about to do is not much of a debate, but probably more of a discussion in your benefit about how we deal with the latest pandemic that the world is dealing with. And let's not have two questions about it. This is a global issue. So I have a fantastic panel of people in front of me to discuss this. Together with me and we have a global panel, might I add. So together with me from Houston is Dr. Surinder Kaul, who's a faculty at a reputed medical institution in Houston, and is also going to be at the front lines as a physician in treatment of the COVID-19 patients. With me is Dr. Vikas Jogi, again from Houston as well. He's a virologist. He's an adjunct clinical assistant professor of medicine and infectious diseases at Baylor College of Medicine, and is at the UT Texas Medical Branch. He's the chair of infection control and antimicrobial stewardship at HCA Houston. And with me is joining from UK is Dr. Shafalica Bhan Kotwal, or as I may say right now, the place that's making the most use, Europe. She's a consultant in psychiatry of old age. She's based in Essex, UK. So we're going to talk about all the aspects of COVID-19, the impacts. I mean, yesterday, for people who had listened to our podcast know that I enumerated three basic things. There's been a psychological impact, a social impact, and obviously a physical impact. And you know how this information is disseminated, what we can do as individuals. We'll talk to the experts about that. So without further ado, let me go to Dr. Kaul first for his opening statements. We'll have 1 minute each from each doctor for their opening statements, and then we'll go to question and answer. So Dr. Kaul.
Yeah, thank you so much for giving this opportunity for making the public aware about what's going on. My name is Dr. Surinder Kaul, and basically I'm based in Houston. And as we all know that this epidemic started with a virus from Hubei province in Wuhan in China, wherein there was some movement, there was some new disease which was coming out, and basically nobody knew, but we saw that in Wuhan province that there was huge devastation and there was lockdown, many deaths. And now we are observing that this is becoming a global issue. And from country to country, this is spreading out. And basically, we need to be very cautious. We need to do a lot of things. This is a disease where individual has to take a responsibility and to stop the transmission. And basically, we in Houston are seeing the rise of the number of cases. We have seen that this disease is spreading in the community. In USA right now, we have New York, which has become the center of the eye of this whole disease processes. Washington State, and basically New Jersey, and it's catching up. And other countries, Europe, are also getting into this, and this is a high time that we realize the importance of this pattern and take certain precautions. And
so what those precautions are, we'll come to that, but I'll go to the others for their opening statements, and then we'll come to the individual questions. So Dr. Jogi, over to you next.
Hi, I'm Vikas Jogi. I'm an infectious disease doctor in Houston, Texas. And we already know, as Dr. Kaul stated, the essential facts of this epidemic, which started in China and spread everywhere. And now the secondary focus seems to be Europe and the United States. So these are unprecedented times. This is a global pandemic, which is the biggest since the Spanish flu in 1918. Though the mortality seems to be considerably lesser, there seems to be a lot of morbidity, and it has caused general anxiety, given the fact that there is no vaccine and no cure. And we're all together worldwide and facing this devastating illness. And we are scrambling to find protocols and treatments and cures and such. That's all I have to say.
Absolutely. Dr. Shafalica, your opening statement, and you're probably in the middle of it all there.
Yes. as you must have heard, it's escalating here, and we are in the middle of a pandemic. With the psychological symptoms, anxiety is the most common symptom which we have to watch out for, which is also turning into a pandemic at the moment. Because with physical symptoms, at least they are visible. You know, if people have physical symptoms, you can see them, but psychological symptoms are hidden at the moment. And almost everyone I have come in touch with, it's not just my patients, you know, my family members, my friends, everybody is in the middle of heightened general anxiety. And that is a big worry at the moment. So
That is,
talk about that.
We do want to talk about that's like one of the unintended
yes consequence of this. Yeah.
Right. So let me broaden the scope a little bit. Let's start with the first question, saying, you know, the biggest question, and sort of you guys probably are annoyed to the core saying this, that, you know, anyone can be a carrier of the disease, because a lot of young people are saying COVID-19 doesn't affect me, so why should I be following social distancing? You know, what is wrong with what I'm doing? So what would you guys respond to that? Dr. Kaul, Dr. Jogi, anyone, whoever wants to take that.
Well, I would say that, you know, the youngsters are part of society in general, and they have a responsibility towards society. It does not impact the young in a severe way, but they could get sick. I mean, they might be confined to their houses, have symptoms, but their parents, the grandparents, are at risk of more severe illness and death, and that impacts them directly, economically and socially, and society in general.
And correct me if I'm wrong, Dr. Jogi, right now in New York, they're saying there is a very high percentage of people between 18 and 49% who have coronavirus.
Right. So the impact, it affects everybody, but the mortality or the death and the very severe illness is seen more in the elderly. But to a great extent, you could fall ill and be confined to the house or even be hospitalized, even if you're young. So it doesn't really exclude you, but I guess your chances of dying are much less. But that's a false sense of security.
Yeah, absolutely.
And because it does impact everyone around you, including your loved ones. So.
Yeah, no, and also I think a lot of people are saying that your lung functions and functionalities are impacted as well if you are down with this disease for a long time. So even the young people might have it difficult in the years to come. So it's not like they'll be 100%, right? I mean, it's not like, that's what I'm saying.
Well, there's not much we know about this illness at this point because it's been around just for a few months. But I would say that permanent lung damage is seen more in critically ill people. Because their lungs are flooded with inflammatory fluid, and that can result in scarring called pulmonary fibrosis. This is the pattern seen in other severe infectious diseases and illnesses. There's something called a cytokine storm, in which the body releases a lot of chemicals and inflammation in response to this infection. And so that can have long-term consequences. But it's unclear if someone with mild to moderate infection will actually have long-term consequences.
Absolutely, and then that varies. So, Dr. Kaul, I want to come to you for a sort of comment on this community spread. So, what is this whole community impact, and, you know, why should we be concerned about this whole pandemic, like what they're saying?
Right, as we all know that this disease started in Wuhan province of China. And now we are seeing a pattern and it's becoming global. So what is happening? So basically there has been a lot of travel around, and basically initially there were high-risk patients who were coming from Wuhan and spreading the disease. And now because of certain other factors like cruise ships, they became very risky. And similarly, it entered into the community. And now the community who don't have even the risk factors are becoming victims and becoming part of this disease process. Now, I would like to classify this disease as per the data that is coming. We are studying the pattern of this COVID-19. They can be asymptomatic. They can have mild symptoms. They can have moderate symptoms, and they can have very, very severe symptoms. So the challenge is what we have seen so far, which can change because the things are evolving. As of now, it has been shown that people who are elderly, about 60, and having chronic debilitating diseases like hypertension, like diabetes, like any autoimmune disorder, they are showing a very severe pattern of the disease. On the contrary, the younger population, they can be either asymptomatic or they may have mild symptoms. So here is the problem. Now the incubation period of this COVID-19 is about 2 weeks. What does that mean? That means even if somebody is having this virus, they are asymptomatic. They don't know that they have the disease. So these are the people who go out into the mall, who go and interact with the people, and they become carriers, and they become the vehicles for transmission of the disease. Now, some of them can develop symptoms. And now what are these symptoms? That can start with fever, which has been shown in 70% of the patients who have this COVID-19. They can develop cough, and then they can have some shortness of breath. So predominantly, these are the three patterns which are coming out. And in the younger population, they can hold it. But once they interact with the elderly people, they become it becomes very catastrophic, to the extent that we have seen a rapid decline in their respiratory functioning, and they become hypoxemic. They need ventilator assistance, and this is basic pattern as of now. This COVID-19 is showing.
Very important point, Dr. Kaul, and I'll come back to it. But I want to go to Dr. Shafalica on a very interesting point, because it almost seems like we are entering into a different world, right?
Yes,
like,
yes.
Nothing is ever going to be the same again. The way we look at travel, the way we look at people, the way we look, things. So psychologically, what do you think this is? How is this impacting us? Do you see the cascading effects of it last more than even a year or 2 years or something? Or what is your
Yes, I mean, the psychological effects are going to be tremendous, because the driver of anxiety disorders and depression is the loss of control, which we are seeing at the moment. Is we are in a situation where we don't know what's going to happen. Everybody is feeling trapped. There's overload of information coming from all sides, and there is this extreme threat which is at the present time showing no signs of abating, and we don't know what the end point is going to be. So these are all coming together, leading to heightened anxiety and in some cases depressive symptoms. And the thing with psychological disorders is that once they start, it's kind of a vicious cycle. So one thing leads to another, and there's a cascade of symptoms. And that's the worry, that even after the physical symptoms of the population subside and hopefully people start getting better, the psychological symptoms are going to be long-term, for months, and I hope not, but looking at years now.
Absolutely. So Dr. Jogi, I want to come to you now. What do you think are the biggest challenges for the public at large you see, and also for the medical professionals right now?
So for the public, I think the biggest challenge is medically is obviously not to get infected, and to isolate and quarantine themselves as much as possible from their fellow human beings and surroundings, limit their grocery runs. So there are going to be shortages of everything, because supply chains are interrupted. Already grocery stores in the United States are emptying, and you have to go at certain times in the morning to get groceries. Then the physical distance and the social aspects, as Dr. Kotwal mentioned. Then if people get sick, then they're in the hospital, then the family is not allowed in anymore. So I think getting sick and its consequences and preventing illness are the main things for the public. And of course, there's loss of economic status. You can't make a living, and many people, especially in the hospitality, transport industry, airline industry, they're very severely affected by this. I guess someone in the IT world or in the medical world is probably some degree of job security.
ultimately you are going to have sort of a domino effect even in their fields.
Yes,
Right,
yes, yes.
right.
Because what we are seeing right now is there are people who are applying for unemployment insurance. There are people who are, and there is also a sense of panic that is set in the population that am I being laid off? Am I being furloughed?
Right,
And there is really no solution to.
right.
Yeah, but finish your point, Dr. Jogi. What were you saying? Yeah.
So yeah, there's no end in sight. We don't know how long this is going to last and how severe the economic consequences are going to be. For medical professionals, we are very underprepared. The hospitals are very underprepared here in the United States. We lack enough masks, we lack enough gowns and other personal protective equipment. Also, we lack testing. Testing is not optimal currently, though it is expected to improve in the next few days to weeks. So in fact, we take a long time.
You also say the reason why we are seeing lowish numbers in a lot of bigger cities is because there is not many tests done. I mean,
That's correct. That's correct. The tests which were in place or which were put in place just after this epidemic started in the United States take a very long time, and there are not many tests available, so it's very restrictive. So if this infection spreads very fast, and you take 7 days to diagnose a person, that has consequences. More importantly, there are asymptomatic people in the community, which Dr. Kaul mentioned. So you are unable to diagnose those, so you cannot isolate those people. So you cannot control the epidemic until you're able to test large numbers of people. And then in the hospital, because of lack of adequate equipment, you expose health professionals to this virus. And if they get sick, as we are seeing in Italy in significant numbers, then you would take them out of the care of people who need them. And so.
In fact, officially, at least the Italian numbers are far greater than the numbers in China. But then again, we don't know if we're getting very accurate numbers from China or not. That's the scope of another discussion.
Right. The quality of data from China has been questionable because initially the officials there did try to suppress news of the epidemic. But in any case, from Italy, what we are seeing is that it's a very, and even Spain, that it's a very, very serious.
Close to 10%, which is very, very significant.
Right. A part of this could also be explained by the fact that they have a large percentage of the elderly and smokers, but we don't know. We're just speculating at this point.
So yeah, absolutely. So going to Dr. Kaul. Dr. Kaul, tell us a little bit about the familial aspect of this. What if someone comes and, someone has a coronavirus, how do they deal? How does their family deal with that, right? And then we also keep getting questions in the media about should soap water and hand sanitizer and stuff like that protects against COVID-19. So what would you respond to that?
Yeah, Aadit, this is a very important question. This virus, even though has become very notorious, but it is pretty easy to handle, easy to kill. Now, there are certain measures that you can take. You can take it right now. And we have seen that if you do simple hand washing with soap for 20 seconds, it's going to kill this bacteria. Now, if you have the clothes which are contaminated with the virus, if you clean them with the detergent, it's going to kill this bacteria. Now, if you clean the knobs and your contact surfaces with the chemicals, it's going to kill the bacteria. So what does that mean? That means that if we take precautions at the individual level, at the family level, to begin with, it will play a very significant role. So that is, I would highly recommend every family, every individual to practice these measures and take ownership of stopping the transmission of this disease. Now, if you have been exposed, now, there is a lot of questions about wearing masks. So everybody we see is wearing masks. But as per the CDC guidelines, if you are healthy, if you are not exposed, if you have isolated yourself, there is no need of wearing masks. It doesn't help. Now, what are the indications of wearing a mask? Now, if you are exposed to a known COVID-19 patient, that is one of the indications to put in a mask, give him a mask, and ask him to go for self-quarantine. Now, self-quarantine means that this person who is positive, is showing mild symptoms, should isolate himself and all the family, they should maintain a distance of 6 feet. Because the transmission of the disease, as has been seen, is primarily droplet. From person to person, transmission is droplet. So droplet is these small, when we cough or sneeze, so these viruses are in the droplets, and because of the gravity, they fall onto the surface. But somebody can come across from a patient who is coughing, and that can spread the disease. So maintaining a 6 feet distance from another person is a good way of maintaining a social distancing. That is the concept of social distancing, and that plays a significant role. Now, if there is patients who are showing milder symptoms, they should call healthcare. They should not go directly there, but they should call them, and they should tell them that these are the symptoms, and based on that, he or she may be a patient to be tested for COVID-19, because as of now, this testing is for symptomatic patients.
Right, not for asymptomatic patients. So it's a good point you bring up, Dr. Kaul, that it's also personal. Dr. Jogi, I'm coming to you in just a second. But first, I want a quick take from Dr. Kotwal on what is happening in Europe, because three of us are based on this side of the Atlantic Ocean. So I also want to know what is happening, because that's what we hear the most right now, the news. That's where it's, hit the hardest.
Yeah. I mean, Europe, obviously, the situation is quite bad. And Italy is our next door neighbor, and Spain. So we are like looking at Italy and thinking, is that going to be us next? So we are actually 2 weeks behind Italy, both in the morbidity and the mortality rate at the moment. So that's the reason for the high level of panic at the moment in the general population, because every day the news comes that, we are tracking Italy. And even after Italy and Spain being in major lockdown, which we are not at the moment, we still seem to be following their path.
Correct me if I'm wrong, London was on a lockdown yesterday, right? That's what.
Yes. I mean, it's on a lockdown, but it's not really a lockdown. So it's still voluntary lockdown. So it's not been enforced. So although the pubs and restaurants are being closed, it's still, people can still go out. And unfortunately, that's what we've seen is happening. People are still going out and, going out in parks and shopping malls. Some of them are still open. So that's the worry, because you can change your own behaviors and try to change your family and friends' behavior, but general population is still carrying on. So the gravity of the situation is not being accepted at the moment.
Absolutely. Dr. Jogi, I'm coming to you now. And what is like right today we saw in India there was a 14-hour curfew, that the voluntary curfew that the Prime Minister proposed, and it went very successfully. And then 5 o'clock there was a whole thing where people celebrated or applauded the workers at the front line. But what has happened since, and a lot of us thought that it was a voluntary precursor. In in major cities of India, there is a 3-day lockdown that started. So are we going to see that in US as well, Dr. Jogi? What do you think?
Well, the administration is debating whether they should impose mandatory lockdowns across the country. The directly affected states like New York and California, they're definitely, as well as Illinois, they have some mandatory things in place. So it's state by state in the United States. So the federal government hasn't mandated a lockdown yet. And I don't know what stage would they want this epidemic to reach before they did that. But I know they're actively considering it. And some people, there was a rumor that this lockdown would happen from Monday, but nothing so far to confirm that.
Most companies have given work from home stuff and all for their employees.
Right.
Like even major stores like Macy's and JCPenney are sort of closing down and stuff. But as we go into the last 5-10 minutes of the discussion, I mean, you are talking to doctors who have a very, very tough week ahead of them. So, I mean, first of all, let me appreciate you guys taking out the time and making, addressing these questions. But Dr. Kaul, your closing comments and anything that you wanted to add as we wrap up this discussion.
Yeah, I mean to say we need to use our individual responsibilities to the highest level and follow the protocols as expected to break this transmission, to minimize this transmission. So don't go out, stay indoors, don't entertain unexpected guests, minimize interaction, minimize human to human interaction, and basically use technology to spread the message. Secondly, I want to say that, why we want to stop this curve. Why do we want to bend this curve? Right now, the transmission, if it's allowed the way it's going on, it will choke the healthcare system. It will flood the hospitals, that it will be of immense magnitude, which will be way beyond anybody's control. So bending the curve is very, very important. And these measures that what we saw in India, what we are seeing in other countries and other states, in New York also, the human to human interactions has to be minimized to stop this disease. And we have to take a collective role and be part of this management, be part of this scheme, and that is how we'll pave way for healthy and break the transmission.
And I mean, as I'm recording, again, this just based on some breaking news that I've gotten. Apparently, Senator Rand Paul has been tested positive for coronavirus. Again, I'm just reading a few tweets as we're recording, but so I may be wrong, but there are media reports. But what I'm saying is, it's not, you're not going to escape from it. It's like reached the congressional levels and stuff, so it's everywhere. We have to do what Dr. Kaul told us to do. But Dr. Kotwal, your closing comments, your perspective, and what do you think?
I would suggest also look after your psychological health, because this is going to be, it's not a sprint, it's going to be a marathon of a few months, and self-isolation is not easy and can cause a lot of psychological damage. So look after your health, exercise, eat well, build up your immunity, stay in touch. We've got Skype and WhatsApp these days. So try and stay in touch with the community, with your friends, and try and stay positive. Yeah. And don't be hyper vigilant. Be vigilant, but not hyper vigilant as in going into a panic buying spree. But at the same time, look at what you need and monitor it.
Someone told me a very wonderful thing, that when you have 30 bottles of hand sanitizer, the guy you shake hands with also needs 1 bottle of hand sanitizer.
Absolutely.
Don't hold everything for yourselves, guys.
Yeah, so it's something which has spread across the community, so it's not just you on your own. Yeah. So everybody is suffering.
This morning I was reading a report that says that Costco and other stores are actually going to refuse returns on essential products that people hold due to coronavirus. And I'm glad they are, because that will stop people from overbuying them.
Yeah, so be careful. I mean, put up your supplies, but don't go overboard. But the most important thing is self-care for your psychological health.
Absolutely. Dr. Jogi, your closing comments on this.
Well, like Dr. Kotwal said, it's going to be a long haul. These are very unusual circumstances. This is a once in a century event. So it's like being in a war. Right. No one knows where it's going to take us. What I can reassure is that there is an end in sight. Like in China, they did see an end, as well as South Korea, they contained the epidemic. The other thing is the vaccines and the medicines will come out as more data comes in and more resources are allotted to research. And eventually we are going to win over this virus, but it might take some time.
Yeah. So it's going to be a test of endurance and a test of.
I have one submission.
Please go on. Yes, please.
Yeah, I think the good news we have been all discussing about horrific news. The good news is that China has been able to contain the transmission. South Korea is taking, as Dr. Jogi said, taking wonderful measures, which is helping and showing the results. And a lot of studies in US and internationally, a lot of medical randomized trials have been initiated, because there are certain medications which are being tested, which in vitro has shown some better results. And hopefully, if that works, I think we will be allowed to use them. Lot of research is going on, and the vaccines, which is already being tested. I think we should do better, but we have to be very careful. We have to be cautious. And on medical side, there are a lot of activities happening. So that should be for the general public to reassure them that things are.
And maybe we can have a follow-up discussion a couple of weeks from now, and hopefully the picture is a lot clearer, better, brighter for everyone. But so far, guys, from what we have learned from the experts is there is a solution to this. There is a good end in sight. We just have to be vigilant, not panic, and take appropriate measures. And please practice social distancing, guys. It's okay to say no if someone shows up to your house unannounced.
Yes.
okay. Don't feel bad about it. But I thank Dr. Kaul, Dr. Jogi, and Dr. Kotwal for joining us and giving us the time. Thank you guys for all the work you're doing, standing in front of the line, talking to people, talking to patients. Hopefully the end will be nearer, and we'll be doing a follow-up podcast, maybe celebrating it. Who knows that we won over this virus. But thank you guys so much for joining me on debates today.
Thank you. Thank you.
Thank you for
Thank you very much for having us.
All right.
Thank you.
Take it. Bye-bye.